Hey everyone, it's Ryan here from Best Face Forward, again with my friend Dylan, who's going to be helping us out today, and we're talking about anterior pelvic tilt. So the reason I have Dylan here is because that was one of his main issues. So in the video today, what I'm going to be doing is I'm going to be giving him a routine he's going to be using for the next 2 weeks. Then we're going to check up on his results. If you have anterior pelvic tilt, this is also a routine that you can use. Anterior pelvic tilt is exactly what it sounds like. Your pelvis is tilted anteriorly or forward. One of the main ways that you can identify if you have this is by looking at the curve of your low back. If it looks like you have a big low back curve, then you probably have anterior pelvic tilt, because this shifting of weight behind your center of gravity will cause your spine to compensate. So you'll likely have rounded shoulders and forward head posture as well if you have anterior pelvic tilt. Anterior pelvic tilt is caused by the muscles that attach to the pelvis. First, your hip flexors are likely overly tight from sitting too much, which makes your glutes inhibited or weak. They aren't functioning properly, along with your core or your transverse abdominis and your ab muscles, and then in turn your low back. So this is also called lower cross syndrome because, as you can see, it makes like a cross shape. So the routine to correct this is simple. We're going to be stretching the hip flexors, doing glute bridges and planks to strengthen the core and the glute muscles. And I'll get into that in a second. But first, I want to teach you how to tilt your pelvis properly so you're prepared for when you do those exercises. So here we have Dylan demonstrating what it looks like to tilt your pelvis into a neutral position. You can do this by essentially pulling your belly button in while squeezing your glutes, so you can practice getting your pelvis and your core into that neutral position for when you do the planks and the glute bridges, because essentially what we're trying to do is strengthen the muscles that create that proper tilt. So the first stretch we're doing is called couch stretch because you can do it on any couch or any chair. Essentially, you just put your foot up on the chair and you're stretching your hips, you're stretching your quads. You just want to lean back, squeeze the glute that has the foot up, and hold that position for 1 minute. It's going to be a really good stretch, and if you're tight, then you're really going to feel this one. Okay, so now for the glute bridge. He's got his feet at shoulder width apart, his back is touching the floor, he's got good posture with his back here. Then he's going to lift his pelvis off the ground by engaging his glutes. He's going to keep his core tight the whole time, and that's super important. So what we're doing is just a hold here, an isometric hold, and he's making sure to squeeze his glutes, to squeeze his abs, pulling his core in, and that's what's going to strengthen that core. And as he stretches the hips, loosens them out, he's going to begin to get into this more neutral position while he's just going about his day-to-day, and that will improve his posture. Now we're doing the plank. The thing to note is that you want to always be squeezing this stomach in while you do it. So pulling your belly up and squeezing your glutes. It's the exact same as when we were bracing the core with the glute bridge. Now we're just doing it in the plank position. So this is going to be difficult. Another thing to think about, Another good thing to do would be to time how long you can hold each floor at first and then see yourself improve. I'm going to put the routine up again for you to do every single day. Well, you can do the glute bridge and the planks every other day if you want, but you want to see yourself making improvements. And the more you do the stretches for your hips, the more easily you'll be able to engage your core and squeeze your glutes, and that will all turn into you fixing your anterior pelvic tilt. So guys, I hope that this helped. Now we're going to check back with Dylan in 2 weeks and see if it made a difference on his anterior pelvic tilt. And I look forward to the next video, and thanks for watching.